Good morning, everyone. This is Melanie from Marcus Evans. Thank you all for attending today's webinar, How to Hire and Retain Top Nurses During COVID-19 and Beyond, brought to you in partnership with Incredible Health. Before we begin, I would like to cover a few housekeeping items. As you can see at the bottom of your screen are multiple application widgets you can use. All the widgets are resizable and movable, so feel free to move them around to get the most out of your desktop space. If you have any questions during the webinar, you can submit them through the Q&A widget. We will try to answer as many as possible, but if a fuller answer is needed or we run out of time, we will make sure to follow up with you in a separate email after the webinar. At this point, I would like to briefly introduce you to our moderator. Joining us today, we've got Iman Abuzeid, CEO and co-founder of Incredible Health. Thank you.
All right, welcome everyone. Today we're going to be covering how to hire and retain top nurses during COVID-19 and beyond. This is the topic of retaining and hiring nurses, particularly those that are permanent nurses, is a top of mind issue for many hospital leaders across the country. So thank you so much for joining us. And we have a fantastic panel ready for you today. All right, so starting from left to right, we'll do quick intros of each panelist. First, we have Linda Roan, Chief Nursing Officer at Banner Health. Linda, do you want to give us a minute or so of introduction?
Sure. Good morning, everyone, and I'm so glad to be here with you this morning. I'm Linda Rowan, as Iman said, and I am a CNO at East Morgan County Hospital, which is a hospital in northeastern Colorado. We're a small 25-bed critical access facility, and while you wouldn't think that we were all struggling with COVID over the last year, we certainly did as well, and it certainly had its challenges, and we'll talk more about that today. Thank you.
Fantastic. Debra?
Thank you, Iman. I'm Debra Potempa, System CNO for MercyHealth. I've been with MercyHealth for 11 years, in Wisconsin for the first 8 or 9 years, and moved to supporting the Javon Bea hospitals in Rockford a couple of years ago. It certainly has been a challenging year, but I think we've learned a lot, and I'm excited to be able to have a discussion about that today.
All right, and then Javon?
Hi, my name is Javon Bea, and the President and CEO of MercyHealth for the last 31 years. Our health system has grown tremendously over those years, and as a result, our need for nurses have grown. And, we've seen different times where it's been more difficult and it seems to let up, but something's been changing, we believe, at least in our part of the country lately, where nurses the shortage continues to grow, the compensation keeps going up, the reimbursement keeps going down. So I think this is a very timely discussion regarding to a critical resource, and that is our nurses.
All right, fantastic. And my name is Iman Abuzeid. I'm an MD by background, but I've spent the last 10 years in healthcare technology. I'm the CEO and co-founder of Incredible Health, which is a career marketplace technology headquartered in San Francisco. We operate nationally, and hospitals and health systems, they use our software to hire nurses in permanent roles in 20 days or less. All right, so in terms of what we're covering today, we'll be doing a quick market overview of the market data that everyone is experiencing. We'll be talking about nurse hiring and retention, how to use hiring data and automation, and then also there will be a pretty lengthy Q&A section as well, so we can hear a lot from our panelists. All right, so let's start with the problem overall that we're all facing. Even before the pandemic, our demand for healthcare as a country kept increasing. Our population is aging, and we just simply don't have enough workers in the system. This is what has created the biggest labor shortage in this country. We simply do not have enough healthcare workers in this country, and the pandemic has certainly made this even more challenging. Healthcare is the #1 employment sector in the US since 2018, and 1 in 8 Americans works in it. But despite that, it does suffer from severe shortages. All right, so there's several implications of this shortage that we all experience. We experience the increase in operating costs. We get more overtime costs, more premium labor costs. We experience burnout of the existing staff because they're being asked to work overtime and the costs associated with this increased turnover. Quality of care does get impacted when nurses are asked to work overtime beyond their 12-hour shifts. The number of medication errors go up, readmissions go up. It also impacts, understaffing also impacts patient and physician satisfaction. And then we're also seeing an intense amount of competition for nurse talent in the market too, particularly nurses that are specialized and experienced. All right, so very briefly, hospitals use our custom matching technology to hire high quality, permanent, and experienced nurses in less than 20 days. In terms of how it works, the employers are applying to the nurses instead of the other way around. So we really flip the script here, and the nurses absolutely love it. In addition to that, we have proprietary screening algorithms that have been built in, and our software pre-vets the candidates. We do build custom matching algorithms for every employer that we work with, so it's a highly personalized experience, and we have robust data analytics that we provide to our teams. And the end result of that is employers hiring permanent and specialized nurses in 20 days or less, which helps alleviate many of their financial and quality challenges. We operate across the country. We work with over 250 hospitals and health systems, including large health systems like HCA and Baylor Scott and White and Kaiser Permanente. We work with many academic medical centers, including Stanford, USC, and Cedars-Sinai, and lots of community hospitals too. A lot of the data that we'll be referring to and mentioning throughout this webinar is with permission from many of our employer clients, and that they've agreed to share with everyone. All right, so let's jump into our questions. Let's start with quite an open question that many executives are grappling with this year during the pandemic. I guess let's start with Javon maybe. So Javon, how are you thinking about permanent nurse workforce planning over the next 12 months? And just even strategically, how are you thinking about it?
Yeah, so that's a great question. And in fact, I've charged, even prior to the pandemic, the pandemic has been very acute and taken all hands on deck. But prior to the pandemic, we saw a nursing shortage looming in our part of the country. And I don't think the solution is just going to be competitive hospitals trying to outbid each other for nurses. Money is one objective, but frankly, it's kind of at the lower end of Maslow's hierarchy of needs. I think culture is a key part, and I've asked our nursing leadership and our HR leadership to look more broadly at coming up with different care models. In other words, having our nurses work at the top of their license, their capabilities, and then taking tasks that are below their educational level and having bringing in other members of the care team. If you look at, I've been in healthcare for well over 40 years, and nursing moved to the BSN model, and with that came an increased growing shortage. And so I think we need to have our BSNs operate at the maximum of their license, and we need to look at other caregivers that they can lead to do more, to do less tasks that doesn't require a BSN. And so it's really, we're in the midst of really putting together an innovative nurse workforce strategy that talks about not just recruiting in various ways and what goes into it. Again, money's a key part, but culture, other aspects, but also, Iman, looking at a broader strategy of how to take the nursing functions and have them handled by the appropriate educational levels. So CNAs is an example, and growing our current experienced CNAs into RNs and bringing in a new pool of CNAs. And I think Deb, I can refer to Deb, but I think she Chief Nursing Officer for MercyHealth. And Deb, you might want to, I don't want to take over Iman,
Yeah,
but
please. Yeah, of course.
if
Deb, go ahead.
Thanks, Javon. Yes, Javon did mention that our task was to look at new models of care, and we're right in the middle of that today. And we're doing it, we're taking a system approach, building on the experiences that we had going through the pandemic. And, you know, while the pandemic was probably one of the worst experiences for many reasons for all of us, I think there's pearls in there. And so we're trying to look at those pearls. As an example, we were forced to staff units, critical care units, emergency departments in ways that we would have never thought to do before. And our nurses probably would have really, been in great opposition to before. But, you know, during a pandemic, when you're working with an even shorter supply of nurses, some of them sick themselves from COVID or helping their families, everyone kind of pulls together and gets creative. And so we've been for 6 months kind of realizing the experience of cross-training, helping hands, utilizing folks from other areas of our health system that weren't traditionally working in bedded units, for example. And, you know, we've been able to do it safely. And, you know, while it probably wouldn't be what we would have chosen to do at the time, right now what I'm doing is asking all of our nurse leaders and our direct care nurses to sit down and think about, you know, what are some of those things that did work well, and knowing that we're not going to be able to go back because of a shortage, what can we do to change the model of care? It's a great time because minds are open now. And so it's been exciting for us. We're just in the beginning stages of it, but I'm excited to see what comes out of it.
All right, fantastic. So you'd mentioned having nurses operate at the top of their license, creative staffing, cross-training, taking advantage of COVID because people are more open-minded right now. Linda, I wanted to turn to you and hear how you're thinking about this at Banner Health.
So we kind of had a tale of two surges, actually, over the last year. The first surge occurred for us in March, April, and May. And then in most of the rest of our system, Arizona in particular, we're not experiencing a surge at that time. So when we had double and triple the occupancy of our patient load, we were able to draw on those different hospitals within Banner to help us with our staffing needs. So we had nurses that came from Wyoming and nurses that came from other areas in Colorado and Arizona to help us to get through the surge. And so we didn't really experience the shortage during that time. And it really encouraged our nurses to believe that being part of a larger system is really beneficial because we do have the resources from the system to help us through a surge. The second surge occurred in August and really got into the thick of it in the end of September through December. And that was a much worse surge. We had probably quadruple the number of patients that we typically had. There were times that we had over half of our patient population was COVID positive. So it was a lot. It was a lot heavier of a surge, and unfortunately, the rest of the country were also going through a surge at that time. So we didn't have the resources that we had in the first surge. So we were really dependent on a lot of our coworkers, and we did a lot of the cross training that Debra talked about, the cross training, the helping hands, and we started that in the first surge, thank heavens, because by the time we got to the second surge, we were really able to depend on those other staff members. Our nursing leadership staff stepped in. They helped with the day-to-day patient care as well. So it was a much longer surge. It was a lot more difficult. The patients were not as sick, thank heavens, but we did have a greater patient population. We're very fortunate, and we have been fully staffed for our core staffing for the last 12 months. So we started off with a very good core group of nurses, but no way did we have enough people to withstand a quadruple patient population for our hospital. So so it was tough to get through, but I think the teamwork that came out of the surge and the just the willingness of other departments to come in and help was so beneficial, and it really has brought to the forefront a whole new feeling of teamwork in a critical access facility.
All right, fantastic. I think both of you have referenced helping hands. Could you explain what that is to those that are listening?
We used the term helping hands when we took a nurse maybe from a med-surg unit or a clinic, and quickly trained them in a few of the skills that they could learn in short order. All nurses know how to safely pass medications and take vital signs and do assessments on patients. So, for instance, in the intensive care unit, we might have had to work with one registered nurse for 3 or 4 critically ill patients. In the height of the surge. And so the way that we brought assistance to that critical care nurse is what we call helping hands. So bringing our nurses from the clinic or our med-surg units that weren't critically care trained, but could be delegated to by that ICU nurse, and they work together as a team to safely manage the care of those patients. We also used our respiratory therapists in the same way. In the very beginning of the pandemic, our hospital was empty with the exception of critical care and in the emergency department. And so we were able to redeploy respiratory therapists to be side by side with the registered nurses and helping to manage ventilators, airway, CPAP, administering, oxygen therapy in different ways. So that's what we would refer to as helping hands.
Okay, got it. Thank you. Thank you.
And we did basically the same thing. However, we also used medical assistants from our clinic and surgical techs as helping hands on the floor as well to help support the CNAs. So, so that was another way that we used helping hands.
Got it. Okay. All right, so let's talk about the all-important topic of nurse retention. Retention is part of probably every team's workforce planning. The first question is, in your experiences, what are the primary reasons nurses leave? And then, of course, the follow-on question from that is how are you addressing these concerns and improving retention? I did want to just pull some data from the Incredible Health platform. We have hundreds of thousands of nurses on our platform. In terms of just like the reasons they leave, the top reasons are work-life balance or burnout, like there's some kind of fatigue is happening. The second is looking for career advancement opportunities, so they weren't necessarily able to advance their careers in their current role. Third reason is compensation, getting paid more elsewhere. And then one that comes up often actually is commute times, especially for those nurses that are operating in more urban areas. So I want to just pause there, and maybe let's go to Linda first, and would love to hear your thoughts on this topic of nurse retention and what it's going to take to keep nurses. So
we saw in the last several years the primary reason that nurses were leaving our facility is due to commute. We hire a lot of new graduates because we have 2 associate degree programs in our area that they come here to do their clinical, and we find that if they don't live in the area, then if we hire them, they're probably going to leave within the first year, just because of the commute. And they come to us because they need experience to go and work in the city at the bigger hospitals. So we found that if we really look at our recruiting strategy and try and find people who are committed to the area, who are from the area, and we're a lot better off in keeping them in our hospital. As a matter of fact, we hired 5 new graduates 2 years ago, and all of them were from our area, and they're still here today. So we have put a lot of time and effort into into recruitment and especially to retention, and really looking at strategies to improve our retention. Another primary reason that we see people leaving, when you get down to the root cause, is leadership. And so we spend a lot of time with our leaders as well, and really spending time training them and preparing them for the job of retention of staff.
All right, Deborah, what are your thoughts on nurse retention at MercyHealth and what's happening there?
Well, I do completely agree with everything that Linda said. I think at MercyHealth, where we're situated, both in Wisconsin and Illinois, we do have quite a bit of competition from more of city-based hospitals, medical centers, and so naturally the pay there is always going to be higher. And so, you know, we do have that conversation with our nurses upon hire, and we really focus on culture. And within culture is, as Linda mentioned, your relationship with your leader. And then also we work very hard in establishing the work-life balance with our nursing partners. So our leaders, our servant leaders, they understand that nurses might have a particular need and a certain time of their life. And so I encourage our leaders to don't say no, say, let me think about it, and then work through scenarios that might be a win-win for both the nurse and our organization. We do a lot of creative scheduling. We do encourage our nurses to pick up extra shifts by sharing a shift. We'll allow short shifts. So if a nurse says, I can just come for a certain amount of hours, you know, we try to accommodate that. We focus on the growth and development of our nurses, and we're very proud of the programs that we have in place. We're a magnet organization, and so we have been recognized for our commitment to our nurses with tuition reimbursement. As Linda mentioned, you know, we do get a lot of new grads. We are very strategic with who we hire. We do look at where they're located and, you know, try to ascertain their commitment to being in the parts of the states that we're located. But we also really put them on a path for their career. So we encourage them to get certified. We encourage them to go back to school. We assist them with their tuition and assist them both monetarily and with educational support to become certified. We put them on tracks for education, leadership, clinical leader, and with a clinical ladder, really promote our nurses to be able to promote themselves as they would on a leadership track, both with extra additional pay and recognition for their level of expertise that they have gained. So, you know, we have found, I think, that culture is really important, and that's a big focus for MercyHealth. And it's something Javon, he really kind of pushes, not only with nurses, but in every aspect of the organization.
Javon, was there anything else that you wanted to add?
I think just a couple of comments. Deb did a nice job talking the way MercyHealth approaches retention of nurses. Two things is that I stress to the rest of the team, all the support team, whether it be IS, facilities, dietary, environmental services, et cetera, that we really need to support our nurses and our nursing units. Certainly it was more difficult before the pandemic, but with the pandemic, I think that acuity by a lot of the support departments have picked up the fact that, hey, we do need to be there and support our nurses. The easier that we can make our job, the better the nurses can serve the patients. The easier we can make the nurses' job, I should say, with them not having to track down and spend a lot of time and effort tracking down facilities or environmental services or dietary, et cetera. The other aspect that I would put is that I've been concerned about, Iman, for a long time is experienced nurses. You know, today, unlike before when you had the 3 your nursing grads that spent all throughout their 3 years working in the hospital, and they could come out and hit the floor. For a long time now with the BSNs, they're very well educated academically, but they're not, the orientation for them can be months before they go on the floor. So the need to retain experienced nurses is critical to me. And I've stressed for a long time that we need to work with our experienced nurses who are great role models for our younger nurses, so that when they hit periods in their life where their spouse may be ready, maybe even retire or ready to go off to Florida for a few months in the wintertime or extended time with their grandchildren, we actually started a program where we let our experienced nurses who've given so much service to basically take a sabbatical and come back without any loss of benefits. And we do whatever we can to retain our nurses so that we can work around the experienced nurses to work around their quality of life that they need as they advance in their careers. Because again, I believe so strongly that experience is key in being role models for our new nurses.
All right, fantastic. So just to quickly summarize some of the comments that were made, to address work-life balance and improving their quality of life, your teams are enabling more creative scheduling, you're allowing short shifts, you're letting experienced nurses take sabbaticals. On the topic of career advancement and tackling that challenge, you're enabling tracks for clinical leadership, your tuition reimbursement, support for certifications. We've heard from some of our clients, they have documented career plans for every nurse, on day 120 from the start date. They have a documented career plan, so they know where their career is going at the organization. For commute, you mentioned hiring from your local area and confirming in the hiring process that they're committed to the area. So yeah, that's a lot of tactical ideas and concepts that the audience can take away. So on the next question is just, we can cover this one pretty quickly. How has COVID specifically impacted your hiring and retention? Has it changed at all your strategies and how you were thinking about this prior to the pandemic versus during?
I can start. Our strategy really is changing, and as I mentioned before, we're trying to take the things that we have learned from what we were sort of forced to do and look at what are the things that worked well. I think the strategy for hiring nurses going forward will be kind of establishing up front that we are really going to be looking for nurses who are interested in maybe not focusing in one particular area, but being open to learning maybe two areas. And I say that because what happened in the pandemic was, prior to the pandemic, people didn't like to float. Everyone knows that. They don't like to float to another unit. And we've tried all kinds of ways to make it more comfortable. But I think establishing up front that this is just, who we are and what we do is beneficial both to the organization and to the nurse. During the pandemic, we had a lot of our nurses furloughed, and they were furloughed in certain groups. Our med-surg nurses were furloughed because we didn't have work for them, not as much work as we had in the ICU and the emergency department. And so I don't think the pandemic is going to ever go away, and who knows what's coming on the horizon, but if we don't plan for it, shame on us. So I think one of the things that we're going to be looking at is for our nurses to be open to looking at maybe two areas and get themselves comfortable with that. Now, certainly critical care is highly specialized, emergency room is highly specialized. But one of the interesting things that we found was that our postpartum nurses had a real sort of an easy transition in helping out on med-surg. And I think vice versa would work as well. So we're looking at, some of that kind of pairing of units going forward. The other thing is that we sit in 2 states, and so really want to take advantage of our nurses being open to crossing the state line, especially in those highly specialized areas, ICU, OB, operating room, emergency department. We tend to, sort of default to getting a traveler if we have an opening, or using an agency nurse. And what we found is that we really can do this within our own system. We just need to build in some flexibilities, dual licensure, and get our nurses comfortable with it. If it's the norm rather than we do it when we have to, I think that we can change the mindset and get people more comfortable with that.
Okay, fantastic. Linda, is there Go ahead.
Yeah, I was just going to say I would agree totally with what you're saying, but I think one of the strengths of a critical access facility is to have that ability to work in multiple areas within the hospital. And so I think as one of our hiring strategies is to really play that up and to make that a selling point to nurses, experienced and new grads, that this is an area for you to really get the experience of the whole entire hospital, and giving them the cross-training experiences early on. One of the things that came out of the pandemic was nurses were expected to go to other areas and help out, whether it be postpartum, labor and delivery, ED, med-surg, wherever. And now they've really opened up to, our med-surg nurses have opened up to, maybe I want to go and cross-train to the ED. Maybe I want to cross-train to labor and delivery. So as a result of their experiences and the teamwork that's developed, we really have had a lot more interest in cross-training to different areas, even to surgery. So I think that there's been a lot of things that have opened up because of COVID. The other thing that we know is that we can never not expect to have another pandemic. And so we have surge plans now in place, and they'll be in place forever because now we know that it can happen and we need to be prepared for that.
Yep. I think, Iman, the only thing that I would underscore with what Deb and Linda has said is that what the COVID, I think, the COVID pandemic brought to us is that we had been too rigid, too fixed in the way that we were hiring nurses to specific unit, departments, states, home health, whatever. We were pigeonholing nurses, if you will. And I think when you hire nurses for something very specific, very limited, they come in with that mindset and then they get into that, get comfortable. Today, we try to, when we hire, set different expectations. When you look at the fact that a lot of nurses want to work for agencies where they're actually moving and getting into different environments, different types of nursing, different locations, having to move geographically for periods of time. We actually, because again, as Deb said, we're across 2 states, we're in 31 different cities. We've got home health, we've got critical access hospitals, we've got large tertiary hospitals, clinics. We really try to set an expectation with the new grads when we hire them that, hey, you're going to have a whole diverse set of opportunities. And we want you to be able to flow between Wisconsin and Illinois. So we're going to help you get dual license and really create right from the onset a flexibility and create that as a positive and not as a negative in their minds, that they're going to be more experienced, more well-rounded. They're not going to get into ruts or burnouts doing the same type of nursing over and over. So we actually have we've changed our mindset and in turn try to set that expectation up front right when we hire the nurses.
Got it. Okay. So we've highlighted we've highlighted flexibility, cross-training. One other topic that we often hear is, teams have really embraced remote hiring and remote onboarding, and that has actually accelerated both of those processes, whether it's hiring or onboarding. Is that something that your teams have experienced too?
Yeah, Deb can comment on that, but we're actually doing virtual. As soon as we're have any kind of a contact with a potential nurse, we send them a remote, we send them an electronic application. We have virtual interviews within the first 24 hours. We have virtual home health, or fairs, I should say, nursing fairs. And so we really have tried to, right, Deb, you might want to comment on that, but we really tried to use that model.
Yeah, I think you've covered it nicely. Our human resources department is definitely a partner with our nurse leaders, and we've done things like geofencing, and we use, as Javon said, we do a lot of video interviews out of necessity, but it's worked so well that I think we really want to continue doing that. It's fast.
Yeah.
You don't have to wait for everyone to drive and be able to get where they need to be. So we have found that's one of those things that the pandemic has taught us that we need to hardwire and keep.
Yep. Absolutely. Great.
Yeah, so
Alex?
we've done the same thing. We've done all of our initial interviews remotely, and we've even done group interviews remotely as well. So especially with nurses, we've done all of our interviews remotely. With providers or specialty like leaders or CRNAs or something like that, we've done most of our interviews remotely until we get down to like the last two, and then we will bring them in because they're so important to the organization that we want to make sure that we're a good fit for them as well. But most of our staff nurse interviews have all been done remotely.
Fantastic. Great. All right, so let's talk about the challenge of hiring nurses. I think all of you mentioned hiring as part of retention, so it kind of retention starts at the very beginning with who you're hiring. We've mentioned already the shortage that we're all experiencing. We've also mentioned competition in some cases too. So for those, when it comes to hiring nurses, particularly those that are experienced, we know that it's relatively easy for almost everyone to hire new grads, but it's the experienced nurses where we struggle a bit more. We'd love to hear a little bit more about your challenges that you're experiencing in your organization when it comes to hiring.
Go ahead. Our biggest challenge is experienced nurses for certain, and it's hard in a small rural setting to have a lot of experienced nurses at your beck and call to come and apply. So that is very difficult. Like Deb said earlier, really playing up on the culture and how a rural hospital is really in some ways much more challenging than other places, and it gives you a chance of being part of a community and really making a significant difference in people's lives in a small community. So we're able to really play that up, especially with experienced nurses who maybe want to get a different kind of challenge. Maybe they've done a lot of different things in critical care and emergency room, or even in labor and delivery and postpartum. And we're able to give them just a little bit different take on a specialty and how you can really be part of something much larger in the community. And I think that's what rural hospitals, rural living really brings is being part of a community, being a significant member of a community and really making a difference.
Great. Deb, did you want to comment on that?
I think one of our biggest challenges is that we are getting so many new grads, and so the challenge then is finding enough seasoned nurses who can work with those new grads and orient them properly. So we've had to make a few changes with the way that we approach onboarding. The other challenge is that, right now, because there is a lot of nurses kind of looking for where they can have a different level of acuity, or maybe they're just burned out and they don't know where to turn or what to do. We have a lot of movement in the city. And so there's 3 large health systems in the city of Rockford, and our nurses just seem to be moving from one hospital to another. So, and then our nurses want to come back, which is wonderful. So I think understanding right now we're in a place where, because it's a challenge to hire so many nurses, we're really focusing on how do we make sure that the nurses that we have feel satisfied and are getting what they need from us. And so we're turning our efforts into working with organizational development, working with employee assistance, helping them kind of talk through some of the some of those challenges that are causing them to feel so distressed. And I think we're doing that as a city, which is nice. You know, normally when you're in a city with competitive health systems, you don't share things, but we're sharing our challenges together because we all know that we're getting nurses from each of the hospitals. So the focus more is on retention than on recruitment.
Okay. All right, so just a little bit of more data from our platform. Our data shows that 68% of nurses, and this is experienced nurses and specialized nurses, 68% of them take the very first job offer that they receive on our platform. And then 61% take their first job offer, even if the compensation is lower than the subsequent offers. So there's something about speed and how that really drives the candidate experience and drives the decision-making for the nurse. This is probably not, your teams have been hiring for a long time. This is probably not new that speed matters when it comes to hiring in a competitive market. I'm curious if there's any strategies or tactics that your teams have implemented to accelerate your hiring speed.
Yeah, so I can maybe comment on that. I've basically encouraged our nurse leaders and HR leaders to really get involved with regional-wise on advisory boards and different levels of educational, universities, technical colleges that train RNs, CNAs, and really, as well as we've strongly encouraged internal nurse residencies in order to have the candidates before they finish school to get acclimated to our health system, to our culture. We work hard with our nursing leaders to encourage those people, make them feel welcome so they want to come back and get hired on. And then I think also, as we talked about, informing the candidates that we really do have a helping hands concept where we try to bring support staff in so that they don't have to do rudimentary tasks up on the floor. I don't know, I've encouraged over hiring in order to have proper coverage for training, vacations, leaves, turnover. And then I would say, Deb, you might want to talk about that. We try to leverage technology for quick access to candidates, and we're always looking for new technology to get us new access. But I think your data there, Iman, shows speed is the key, and that's why we do interviews and applications within 24 hours of a contact. But that's something we stressed a lot, and I push with HR because HR reports directly to me in support of nursing. You might want to comment on that, Deb, at all.
I think we are sort of lucky in the fact that we have dedicated HR generalists to focus on nursing recruitment, and our recruiters work hand in hand with our leaders. Our leaders know very well also that speed is everything, and so it's a collaborative effort on the part of human resources and nursing leadership, that if they've interviewed a candidate, as they're walking down the hall, HR will kind of step aside and say, do you want us to make an offer? And if the nurse leader says yes, then they're texting, back at the ranch and in the HR office to kind of get everything done. Our nurse leaders will call HR if it's been more than 24 hours and say, where are we with this? They'll reach out to the candidates themselves just to have that personal touch and say, if you haven't yet heard from us, you're going to be receiving an offer from Human Resources. So we do everything we can to, keep that touch point with the candidate, but definitely speed is something that we're all focused on.
Linda?
Yeah, we do much the same. The expectation is if we are contacted by any person who is interested in a position, we collect their resume and send it right off to our recruiting team, who the expectation is within 24 hours they will contact and do the first interview with that person. and then they'll send it right to the leader who's in charge of that area. And then the expectation is within either that day or the next day, the leader reaches out to that candidate as well. So it's not uncommon, and right now, that we would make an offer to a new candidate that is, especially if we only have one candidate. If we have several, it may take us a little bit longer to do group interviews, but we really try to do group interviews with every nursing candidate that they're going to be interviewed with their peer as well as their leader. But we try and do that within 48 hours if at all possible, so that we can get an offer to them within that 48 hours. And as soon as we do the interview, if we're ready to make an offer, we send it back to the recruiter and they'll make an offer that day.
Got it. And so let me ask a quick follow-up that's very tactical. Over half the teams that we work with actually struggle at the hiring manager interview step, right? The nursing leaders are taking a little bit longer than they should to complete interviews. When you have this situation, and look, we all have there's always a couple of nursing leaders or nursing hiring managers that are taking a little longer than the rest. When you have a situation like that, how is it that you resolve it? When you discover that a nursing leader is taking a little bit longer than they should to interview, and as a result, candidates are being lost?
Well, I would quickly hear from human resources because I'm always kind of, looking at the data and saying, why is our time to fill long in this particular, unit? And they'll say, well, we have an issue with so-and-so, they're taking too long, or they went on vacation, they didn't assign this to somebody else. So it's something that we have a low tolerance for because it's so important that if we have a viable candidate, knowing that there's a shortage, that this is really a high priority for our nurse leaders. So we get on that really quickly.
We do the same thing. We really stress the importance of doing the hiring as quickly as possible. And every candidate that is sent to the nursing leaders is also copied to me. So I know everyone that's being sent out. So if I don't see some turnarounds very quickly, I just do a gentle reminder that this is really important to do this starting process, because we all know that after they're hired, there still is a long process for onboarding. And so the quicker you can get them hired, it's still going to be at least 2 weeks before you get all the onboarding content done before they're able to actually start on the floor. So if we can speed up the hiring process, it's just going to be better for all of us.
All right, so there was a couple of quick references made to technology and data. You mentioned, Deb, I believe, mentioned time to fill. So I guess how are you using data and automation to improve nurse hiring and nurse retention? And what are the tools and tactics that you've seen be effective from a data standpoint or from a technology standpoint?
Yeah, I mean, I've stressed a lot with our IT to support nursing. As Deb said, she's got to be able to get the data, length of time in hiring. Also, how long is it taking? Deb and I've talked about why is it taking so long in orientation, the length of time, the months, because there's a real cost to that, but how to onboard more quickly. We also look at our social media reports. We look at that at our top executive council level, Indeed analytics, to ensure our advertising is working, tweaking as necessary. We also reach out to candidates with electronic messaging. Hey, can we send you an application? We try to keep contact with them. And I think that we're always looking for new technology in terms of HR and recruiting. And that's why, Iman, we want you to get to our area. That's incredible. Yeah. We provide, but as we commented earlier, we do use virtual fairs and interviews. But I think that it's real important that our HR people and our nursing are communicating often. And that's what we've stressed, a strong collaboration. As a CEO, that has to come from the upper level to stress the head of nursing, the head of HR, collaborate and have all their people collaborate, because it takes that cross-functional relationship to be able to basically recruit quickly. And HR is we're always looking for new HR tools. And so I think, I think the idea of HR technology for being able to recruit, give feedback, key metrics to the nursing leader is key. Deb, you might have a comment on that.
No, I would just add that, we're all looking at ways of lowering the overall cost of healthcare. And this is an area that we, might not have given as much importance to as we do today, and recognizing that every day that we are without a nurse, we could potentially be not filling a bed because we don't have enough staff. And all of that, contributes to the overall cost of care. Our beds should be full as we've budgeted and expected for in order for us to be efficient. We can't really afford to continue to use agency and travelers at the cost that they are requiring. And so, as Javon said, this is an area that we're excited to be able to have a platform that is quick, efficient, it's different, and I think it's going to help us fill a void that we need in the recruitment process.
So I would add that I don't think there's too many hospitals now that are not data rich. And so utilizing that data and really keeping track of the data and making sure that you have goals for your data. So one of the things that we do as a system is we have, HR has specific measurements and specific targets that are necessary for them, and time to fill is one of those. Time to recruit is another, or time to hire is, well, that's time to fill. But the turnover rates, the vacancy rate is all very important, and those are measures that our HR team is held to. But from a nursing leadership team, our banner system is so committed to the RN experience that one of our corporate initiatives for the year is cultivating the RN experience, which includes making sure that people are scheduled correctly, making sure that our FTEs are being filled, and looking at our turnover rate and retention. So we have goals that are set around those measures, and it's very important that we meet those. So we're all held. All the nursing leaders have that as goals for their year.
There was something that Javon said towards the beginning around everyone operating at the top of their license, so they're top of their skill set. That concept does apply to HR as well. When it comes to things like sourcing and screening and scheduling, these are all things that can actually be done with technology and can be automated, which frees up recruiter time to build relationships with hiring managers, interact with candidates. So if we can get if we can reduce the busy work for your HR professionals, and enable some of the lower skill work to be done by automation, that's basically where we're headed here in terms of technology. And then, yeah, absolutely, would love to bring Incredible Health to MercyHealth soon.
The thing that I've been impressed with is you have to have a platform that first attracts a lot of nurses to it. And I think the key of Incredible Health is that I understand, and I'm getting to know more about it, is that you guys haven't really geared yourself so much to trying to please the hospitals as you are the nurses. And when you please nurses, you bring a huge platform of nurses together, which then is easily accessible for the hospitals to put the type of position they have out there. Do I have that right, Iman? Or?
Yeah, that's exactly right. So nurses are at the center. Like, it's a very nurse-centric or candidate-centric platform. With the employers applying to the nurses instead of the other way around. We're offering a whole range of free services and tools to the nurses too. But it's what we're seeing is that the hospital teams that are winning when it comes to hiring nurses have created a very candidate-centric experience. They have created a phenomenal experience for nurses because that is their first interaction with the health system. And that's through rapid speed of getting through the process, of not letting people drop through a black hole, of not letting drop-offs happen at all, of staying in touch with the candidates, always letting candidates know where they are, and just being fast with decision making and sending offers, and certainly embracing things like remote interviewing that speed up the process too. These are the teams that are winning, that are ultimately winning the experienced and specialized nurses. All right, so I had two parts to this question. So, the question is, what advice do you give to your peers to increase their hiring speed? But I also wanted to comment on something that Javon had mentioned. You talked a lot about the collaboration between HR and nursing. With some teams, there can be some friction there between HR and nursing, and they both have their roles to play in order to make sure hiring is successful. I'm curious, how is it that you foster that collaboration? And I'm sure many execs do struggle with this, and would love to hear your advice on the topic.
Yeah, I'll just make one comment, and then I'd be curious from Deb's perspective, but I think it has to start at the top. The CEO has to really put that as an expectation that HR, because HR is not just, HR in general would say, we're here to support all departments, not just nursing, and that's true. So the way that we dealt with that, and I think Deb alluded to it real quickly earlier, is we said, okay, we want UHR to really come up with HR focus, meaning they only focused on nursing. We want those HR recruiters focused on nursing to become very knowledgeable of the nursing culture by unit, by area, by location, because we have so many locations. And so we have HR become very knowledgeable so they can better sell the different nursing opportunities. And it's up to nursing. We told nursing to make sure that you need to spend the time to really educate and the HR recruiter, and so that they can better sell nursing, at MercyHealth to the candidates. So Deb, I'd be curious, do you think those dedicated HR recruiters has that been helpful?
I think that's the key. Our generalists, our HR generalists, are aligned with specific units, as Javon mentioned, and they not only work with recruitment of new hires, but in getting to know the unit and the unit leaders, they kind of have a sixth sense for who might be a good fit. But I think more importantly is they're not just utilized for their expertise in recruitment. They're utilized for their expertise in people and culture. And we use them in an area, for example, right now I have a unit that experienced very high turnover. And so it's just part of what we do to call in the HR generalist and the HR director that is assigned to that area. And we sit and talk about an action plan. How are we going to work with this team to get us to a better place? And it runs the gamut from a team meeting to group interviews to just with this group, we did 25 individual interviews with nurses who were on that unit for 1 year or less. And that was done by the HR team. And then they provide the leaders with the feedback. Here's what we found. And then together we sit and put together an action plan, and we'll work on it for 6 months to a year, however long it takes in that particular unit. So they're truly partners in more than just recruitment. And I think that's kind of the secret sauce that we've created here. So we really don't find areas where there's any kind of a tug and pull between HR and nursing, and a lot of our other departments as well. It's not just nursing.
That didn't happen automatically. I mean, we had to basically top set that expectation, because when cross-functional areas are opposing each other or not totally on the same team, you're just going to have bad results. And so we I think that has to be pushed from the top.
I think this year has been, HR has taken a whole new precedent of being as being part of the facility. They really were the ones who identified the need for resilience training and for EAP support for staff throughout the pandemic. So one of the things that our HRC did, and because we're a small facility, she could do this, is she every month would touch base with every employee of the hospital to make sure that they were doing okay. So HR, I think, just going off what Deb said, HR is so important for culture, and they're so important for developing that team and the culture that's supportive of the difficult work that has to be done on a daily basis. So she has done an amazing job of working with each individual staff member. She knows them all by name. She knows what their families are, what their families are, and or who their families are and what their values are, each individual person. And boy, she's done a great job of just building on that.
Okay, that's great. All right, let's do some audience Q&A. So let's go through. I think we have time for a couple of them. So this is an interesting one. So how are you designing your environment or your culture to allow nurses to experience and offer compassion?
Well, I can speak to that. I think just exactly what I was just talking about. I mean, from an HR and from a leadership perspective of really making sure that the environment is set up for that. And I'll just give you one specific example. During the pandemic, luckily our facility is all on ground level. And so when we had patients that were end of life patients, and especially during the summer and during this late spring, if their family was here, they would gather. We would provide them shelter outside of the patient's window so that they were all able to be present during that time because they couldn't visit the patient. And so they would come, they would be at the window, they would put messages of hope and support on the windows. And it was an amazing experience for both the patient, the families, and for the nurses to just have that connection that we wouldn't have had if it wouldn't have been for that.
Yeah, that's a great example.
I think compassion is one of those things that is just sort of a part of the job description for a nurse. It's one of the things that's caused them distress recently with them not having the time to be able to spend quality minutes with patients and families. But they have, as Linda mentioned, found ways to do it in spite of the fact that they might not have as much time as they would like to have had. Connecting with families during the pandemic and being able to help a family say goodbye to someone who is going to be passing away from COVID has been, an experience that's been a rich experience for the nurses, but, it's something that has also caused them some distress. So, as I said, I think it's a natural qualification for being a nurse. And right now we need to make sure that we can feed them. And I mentioned earlier, we're using organizational development to kind of work with them on their mental capacity for self-care. We are bringing our EAP programs to the units so that they could take advantage of maybe doing that in real time rather than trying to make an appointment and go see someone. But really, staffing is what the nurse will say is going to allow them to get back to being able to do all the things that they need to do with patients, and showing compassion is just one of those.
Okay, sounds great. All right, well, thank you so much. I think we're at time. If anyone in the audience has more questions for anyone on the panel or for the team at Incredible Health, please feel free to send your questions to questions@incrediblehealth.com, and we'll make sure to get those answered. Just wanted to thank you, Linda, Javon, and Deb, for joining and for offering all your strategies and your tactics, and hopefully those that attended can have a lot of takeaways from this session.
Enjoyed it. Thank you, Iman.
Thank you.
Thank you.
Thank you, Iman, and thank you all for sharing these great insights. Incredible Health team will be reaching out with a summary of the webinar. We would also like your feedback, so if you could take a minute to answer our very brief survey that will pop up on your screen at the end of the session, that will be very much appreciated. On behalf of Incredible Health and Marcus Evans webinars, we would like to thank you all for joining us, and we do hope that you will be listening at our next webinar. Thank you.